This is Dr. Timothy Scott Beck here. It is July the 20th of 2021, and I want to say good morning to you and let you know that we are here and we are working as hard as we can to get everybody taken care of. We are short-staffed, so I just want to remind everybody, it doesn't mean we can't see you. It just means we got to play a little game to make sure everything goes smoothly and people don't spend too much time in the waiting room. We actually think about that every day, okay? So we apologize if you have to wait, okay? But we're constantly evaluating and analyzing what we're doing so we can minimize wait times, get everybody seen that needs to be seen, and get them done seen appropriately and not in a hurry and things like that. So please forgive us in advance for if we fail on all those things, but we're just trying to get it right. And that was part of the reason I had those, we're doing evaluations of my practice, okay, because they're telling me, they're looking at all things. What are you doing for the patient? Are you being appropriate with the level of care that you're providing? And are patients waiting too long to be seen? All that stuff. We just talk about that stuff. We analyze it, and we try to do the best we can. And the downside of that is a lot of people come in and they'll interject their whatever to me about what they think should happen, and we have to mediate that, okay? Because this is like a circus, okay? And we have to keep everything as organized as possible. So just please remember that, and that'll help us out if you can remember that. And we are going to try our best to accommodate everybody as best we can. So I had a very wise patient tell me this morning that if they could talk to their younger self, they would tell themselves to stay active and don't let your activity level fall off. And actually, I agree with that. And I've tried to stay active most of my life with some waxing and waning, sometimes more than normal, sometimes less than normal. But I never stopped being active. And what I mean by active is doing regular exercises, getting your heart rate up, sweating on a regular basis. I do know things that will stop you from exercising and taking care of yourself, like the COVID thing. The COVID thing put a halt to a lot of people's abilities or what they were doing to take care of themselves. Stress, trauma, lifestyle changes. We had a baby, so sometimes a baby stops families from doing anything. Fortunately, I didn't stop. Didn't feel like I had the luxury of stopping. But anyway, the idea is if you maintain a certain level of activity throughout your life, you will reap the benefits as you get older in your 60s and 70s. And that's what I've been gambling on, and I hope that it works out for me. Interestingly, I don't see a lot of people with problems like knee surgery, knee pain, things like that. Those are not directly correlated to activity level. It's actually the other way. If you don't exercise and you don't maintain some level of physical activity, you're more likely to have more problems like knee pain and heart disease, obesity, back pain. Back pain's a huge one. Okay, I've got bricklayers, people who laid brick their whole life who don't have back problems. And then I've got people who have not been physical for many, many years. Their job is sitting at a desk. They have back problems. So keeping a balanced tone in your body with your musculature as you get older is key. And I always tell everybody, maintain your symmetry, front, back, left, right, up, and down. If you can look at your whole body and say, I'm going to stay as symmetric as possible with my muscles and the amount of work that I do for them, I do believe that you will get a great benefit from it in your 50s, 60s, and 70s. Some two hot spots that I always tell everybody is your anterior abdominal muscles, the muscles right here. Keeping those good will help with back pain, and then keeping your anterior thigh muscles, the muscles on the top of your legs or your thigh, I know if you keep those balanced out, those will help with knee pain in the future, and I've talked about that before. So the wise person said, tell your younger self to stay active. So I'm telling you that too. So if you haven't stayed active and you want to be active, I recommend you start slow. And if you need us to help you, like get started with physical therapy and stuff like that, we'll do that. And a lot of times I tell people when they go to physical therapy, I say, go there as a student. Go there as if they were teaching you how to take care of yourself for the rest of your life. And I think they don't mind me saying that, and they like that, okay? Because we all just want to see people get better, improve their lives, and live a good life. All right, let me get on to the COVID-19 things. 1,602 cases, so 2 more cases. There is that variant going around that people are talking about. I have not really seen any credible information to tell us anything about it here in this area. So we're just going to keep our eyes open and see what's going on. We've got cases trickling in, but they're very mild and they're not voluminous, and it's probably related to the amount of transient people we're getting around here. You know, people coming here on vacation, because this is a lovely place to vacate to. All right, Place of Hope, North Georgia is still running. If you want to know more about it, please ask me, because I'll tell you all about it. placeofhopenga.com is the website if you want to check it out on there. Otherwise, have a great day. Call me if you need me.